Okay, I think I'll start. So good morning, and I know we have people joining us from around the world, so good afternoon and good evening. So my name is Sonia Laszlo, and I'd like to extend a very warm welcome to all of you for this last, but definitely not the least of our special webinar series on the impact of the pandemic on women and girls in developing countries. Now, as many of you already know, this series aims to engage researchers, policymakers, and practitioners on matters around women's empowerment and the impacts that the pandemic and the associated crisis has had on women in the global south. So in our previous 7 webinars, we've explored how women and girls around the world have been experiencing this dual and historic health and economic crisis through the lens of different themes. We've looked at labor market impacts, the impacts on unpaid care, on gender-based violence, on girls' education, on social protection program provision, and also in particular settings and contexts such as refugee and migrant populations. And throughout these webinars, we've heard from academic, policy, civil society, and practitioner experts who have highlighted some of the pressing research priorities and policy implications in this very constantly evolving situation. Now, these recordings and summaries will remain available on the WedLab website, even as the series comes to a close. But today, we're going to take stock and do a deep dive into some policy solutions. And I'm really, truly honored to be joined today by 4 distinguished experts who will give us important policy perspectives into what solutions might look like in the short and the medium run. But first, let me introduce, for those of you who may not be familiar with the Women's Empowerment Lab, let me tell you a little bit about who we are. We are a research and research to practice lab at McGill University, and we're really immensely grateful for the support from Canada's International Development Research Centre through its Growth and Economic Opportunities for Women, GROW program. And GROW is a 5-year action research program jointly funded by the Bill and Melinda Gates Foundation, the William and Flora Hewlett Foundation, and of course IDRC, to find some scalable solutions for advancing gender equality in the world of work. Working with partners in East Africa, the program focuses on 3 areas, but of course in this webinar series, we look at things more globally. And so those 3 program areas are as follows: addressing gender segregation in employment, reducing and redistributing unpaid care work, and unleashing women's collective agency. While we are meeting virtually, the series and the lab are hosted by McGill University, which is located on land that has long served as a site of meeting and exchange amongst Indigenous peoples, including the Haudenosaunee and Anishinaabe nations. McGill honors, recognizes, and respects these nations as the traditional stewards of the lands and waters on which we meet today. Before introducing our panel, just a reminder of today's run of show. We will have each one of our panelists speak for about 15 minutes, and then we will have a moderated Q&A. And for those of you in the audience, you'll notice at the bottom of your Zoom screen, there's a little Q&A box, and feel free to put your question in there, and then we will address those during the question and answer round at the end. Just a quick note, we have 4 speakers. One of our speakers, Carolina Tribelli, will need to leave the question and answer a little early. So if you have specific questions for her, we would maybe ask that you make sure that you pose those in the question and answer as early as possible. So without any further ado, I'd like to now turn to our panelists and introduce our first distinguished speaker, Ms. Thokozile Ruzvizo from the United Nations Economic Commission for Africa. She is the Director of Gender Policy and Social Policy Division that leads UNECA's work on poverty and inequality, social protection, gender equality and women's empowerment, migration, urbanization, and various other experts of social development. She has experience working with governments, civil society, and international development organizations. Toko has over the last 40 years held leadership positions in various institutions. As a gender expert, she has country, regional, continental, and international experience. She works extensively on women's rights, gender equality, and women's empowerment. Her work on the African continent has made her aware of the critical dimensions around gender equality and women's empowerment in different sectors. She has also led research and policy work in social development, giving her understanding of critical issues of development on the African continent. So with that, Toko, I will leave the virtual floor to you. Thank you.
Thank you very much, Sonia. Distinguished panelists, ladies and gentlemen, it gives me a great pleasure to join you here, and I wish to thank the organizers for inviting me to this discussion on a very important topic that is extremely timely. The COVID pandemic, as we all know, is accentuating the disparities leading to worse outcomes for women and girls in terms of livelihoods and well-being. It is critical to ensure that the response and recovery policy interventions are put in place and they reach women and girls. Today, I will highlight two aspects of the pandemic on women and girls, focusing on livelihoods and girls' education. And I will consider one, the gendered livelihood and education effects, and then two, the mitigating policies. Let me start by looking at the gendered livelihood and education effects, but specifically focusing on livelihoods. And there are three main areas where COVID is impacting livelihoods. One, unpaid care work. And Sonia did, in the introduction remarks, refer to the importance of looking at unpaid care work. In some countries, at least 2/3 of all unpaid care work are undertaken by women. The figure is as high as 92% in Mali. Caring for relatives as a result of COVID-19 and young children kept at home from school and daycare facilities is adding to the existing burden, and I'm sure we all know that. As a result of social norms, this extra burden is increasingly being borne by women and girls. This acts as a barrier to accessing education for girls and paid formal employment for women, whilst formal employment itself is being challenged. Then two, government policy responses and measures to reduce the spread of COVID-19 have caused loss of livelihoods. Containment measures of shutting down markets, and I've seen this especially where I'm sitting right now in Zimbabwe, where the informal sector is literally almost been shut down. Workplaces and borders across the continent have accentuated gender inequalities. Businesses are operating with between 30 to 60% less employees than normal. These measures tend to have a disproportionate impact on service sectors, which has high female employment, and shares including textiles, garments, and fresh cut flowers, travel and tourism, with very limited opportunities for these workers to work from home. The collapse in the demand of fresh cut flowers is putting the livelihoods of 300,000 workers at risk in Ethiopia and Kenya, and most of these workers are women. Those working in the informal economy are vulnerable. Across Africa, 90% of unemployed women are in the informal employment compared to 83% of men. Women are often found in the most vulnerable situations, including domestic workers, home-based workers, and contributing family workers, agricultural sector in the rural areas with limited access to social protection. ILO estimates that the earnings of the informal economy workers will decline by 81% in the first month of the crisis. And we can see what then this means for women, the majority of whom are in the informal sector. This is supported by the evidence from the 2014-2015 Ebola crisis, Ebola virus disease, which showed that the livelihood of many business women who relied on cross-border trade to purchase and sell goods, especially agricultural products, were adversely affected as a result of containment measures. Focusing on education effects, school closures are putting female learners at a great risk of falling behind boys in educational attainment, child marriage, teenage pregnancy, and dropout of school. So it means the female learners are getting disadvantaged. The prolonged closure of schools and the diminished protection from relevant authorities as resources are diverted to fight the pandemic create an enabling environment for girls to drop out of school, increase child marriages, sex transactions between young girls and older men as a means of economic survival for women. And unfortunately, because now data is less accessible, it means we are not able to access the numbers of girls, especially, that fall victim to the situation I'm presenting. Then the increased burden of unpaid and domestic work during the pandemic, combined with the gender digital divide in accessing internet and mobile technology, limits the opportunity of girls to continue to learn at home during school closures. This is especially the case in rural areas. COVID has highlighted how education needs to rely on more sustainable and holistic measures. There is a need for government to invest in nationwide ICT infrastructure in schools, including strategic crisis management plans and funds geared towards education to make it easy for a smooth continuation of education during times of crisis. So what does this mean when we want to look at policies? Let me look at the policies in relation to livelihoods. The immediate response to the devastating impact of the pandemic on livelihoods has been the introduction of cash transfer programs to transfer cash to support vulnerable poor households. However, there is a great need to both, one, extend this to the informal sector, because often these cash transfers do not extend to the informal sector. Then two, to adopt digital solutions to ensure payments are timely, reach the correct beneficiary, and to strengthen accountability, but also considered any gendered bias in access. I know before COVID-19, we used to talk about these measures, but with COVID-19, they become a reality and critical that they are put in place. One such example of a cash transfer scheme in Africa to support workers affected by COVID-19 is the Novid Social Safety Network scheme in Togo. Under the scheme, informal workers receive a state grant worth at least 30% of the minimum wage to help them to pay for basic daily necessities such as food, sanitation, and communication. Payments are made directly to the mobile money account of beneficiaries. Women receive the highest possible payouts under the scheme. So in the short term, medium term, economic rescue measures targeting women-led businesses should also be prioritized, including those that are in the formal sector, using subsidized and state-backed loans, subsidized inputs, tax and social security payment deferrals. It's critical that we look at this. Then C, regarding unpaid care and domestic work, recognition should be given to unpaid care and domestic work undertaken by households, which are performed, as I've said before, mainly by women. This should lead to an increase in spending on pre and primary education, healthcare, social protection, water, electricity, with a view to reduce and redistribute between women and men, and between households and the state, and to reduce and redistribute between women and men, and between households and the state unpaid care and domestic work, so that the unpaid care and domestic work is shared between women and households, but also between household and the state, especially as we see a lot of the care work falling into the hands of women. Progressive parental leave policies will also be important in this regard. Let me look at girls' education and the policy response. As far as girls' education is concerned, it is imperative we ensure that every learner has the opportunity to continue their education during school closures, through distant learning, through digital solutions, through radio, through television. And I want to give an example very close to me. My helper at home, her daughter has not been able to go to school, and she lives in the rural areas and has not had access to education until I took it upon myself to help with that. This is a reality that I've seen and I live with, whilst I know that in most of the schools in the urban areas, kids have access to education through telephones and digital. Therefore, there is need to have digital tools and hardware and software that the rural areas are able to access. I also want to highlight the partnership between UNICEF and Airtel Africa, which is where I see mobile phones playing a role to provide internet access to an estimated 133 million school-age children currently affected by school closures in 13 African countries. So here we're looking at the private sector and government coming together, and of course all the other players, including the UN, and ensuring that education is provided. I can see us going to 2021 with schools in most of the African countries not being accessible. Therefore, policy initiatives to increase school attendance, e.g. social protection programs, school feeding initiatives, sanitary protection materials are critical when we open come 2021 or when we are able to manage the COVID-19 impact. Undertake education awareness programs that target parents and community leaders in order to tackle the bias that comes with cultural and social norms and that impede educational achievement of girls and the value of girls' education. This has been an issue that we've echoed over and over again, and I think it becomes more vivid under COVID, where because the girls also assist in domestic chores, they don't get the opportunity either through the radio programs or telephone programs where they are available to be able to listen through. Therefore, the cultural and social norms also need to be addressed even under COVID. Incentive policies and temporary special measures for gender parity in participation at all levels and across all subjects, including STEM. Through scholarship quotas, training programs, mentoring, and I'm emphasizing this even under COVID because we still need to keep emphasizing the importance of girls under STEM. Programs that started before COVID have to continue. Otherwise, come post-COVID, then those programs will we are starting afresh. Of course, the greater focus on digital skills in the school curriculum to improve digital capabilities. I can imagine if this had been emphasized on and a lot of resources put in, we could have kids, young girls that are able to use the digital capabilities that they would have got. Then we need to ensure that there are re-entry policies that are put in place and that don't prohibit. I can imagine after COVID, the number of pregnant girls that we're going to have. We need to look at that. These girls are not prohibited to come back to school as young mothers. And in some cases, they will be married girls because of the condition that they are facing under COVID. And then we need to ensure that the budget are not diverted from education to fight COVID. Yes, it's a health issue, but it's also an educational issue. So resources should be not just for the health sector, but for the educational sector. Thank you. And I think I was right on time.
Wonderful. Thank you very much. Yes, indeed. And thank you for giving us such a thorough look at so many of these issues and some policy angles that resonate, I think, quite strongly with everyone. I'd like to now turn to Carolina Trivelli, who works as senior researcher at the Instituto de Estudios Peruanos. And she's an economist and holds a Master of Science in Agricultural Economics from Pennsylvania State University. She's a member of the board of CUNAN, a social entrepreneurship network, Sembrando Juntos, and of Bucera's Center for Behavioral Economics. She also serves at the International Advisory Board of RIMIS, Latin American Center for Rural Development, and is a member of the high-level panel of the ID4D initiative at the World Bank. She's a board member at Banco de la Nación in Peru and Banco Sol in Bolivia. She's also a member of the Technical Advisory Committee on Measuring Poverty at the Peruvian Statistical Agency and at the Fiscal Committee of Peru, an independent body appointed to oversee the country's fiscal policies. She's currently a columnist for El Comercio, a national newspaper, and she works as an independent consultant for several international organizations. Also, she was the Minister of Development and Social Inclusion for Peru from 2011 to 2013 and has worked as Managing Director of Pagos Digitales in Peruanos and as Director General of the Instituto de Estudios Peruanos from 2001 to 2005. Carolina, the floor is yours.
Thank you, Sonia, and thank you all for the invitation. I'm very grateful to have the opportunity to be this morning with you. To take advantage of my 15 minutes, I would like to just skip the diagnosis. You've been discussing that for several weeks now, and the case in Latin America for women is exactly as was said by the previous speaker. Women are overrepresented in the informal sector, are overrepresented in works in the service industry and the commerce sector, and those are the more vulnerable sectors to the present situation, the lockdowns, and all the other restrictive measures we are facing to face the COVID-19. So the situation for women, especially for the more vulnerable and poor women in Latin America is critical, and we need to find solutions to really help them now. We could discuss several measures that we need to address to improve the position of women and the power of women to really take advantage of economic and social and cultural opportunities. But today, I think we are in a emergency situation, and we need to find policy solutions to really help women to overcome these difficult times. I would like to go directly to some policy recommendations, and in three different buckets. First, around how to really support women livelihoods, given that they work mostly in the informal sector, and especially within the informal sector in the service and commerce sectors. They really don't have much opportunities to really re-engage in their previous work, also if the lockdowns are relieved. One of the things that we are seeing that is critical for women today, especially considering their increased care economy work, is to really help them with temporal labor opportunities to generate income. But the key issue here is not just to reshape these public works programs for short-term contracts for women, but to make them local, really local, highly local. You know, women need to work very close to their homes today. It would be better if they could work at home, but that's highly difficult given the skills and the type of public works we are used to have. But there are new job opportunities that local authorities, local policymakers could really help to create and support women with those. For example, now one hotspot for COVID-19 spread are the markets, and we need better markets. We need cleaner marketplaces. Now, in the case of Peru, 80% of the population still goes to a street market to buy food. So we really need to improve those places to ensure a better health outcome. And we are doing very poorly in that sense. So we really need that too. So for example, local authorities could create public works programs oriented to women to help organize better the markets. And that's highly local. You can go and work in your local marketplace. And that could be a very significant solution to generate decent work opportunities, temporal, just to avoid the emergency, as a complement to cash transfers, for example. As a second policy action that is relevant is that recognizing that during the lockdowns, what we've seen is that most women, entrepreneurial women, strictly ate their working capital. We need to activate microcredit networks to really support the access to working capital for those women that had very small businesses, independent work, you know, selling food in the street or selling something in the marketplace. And most of these women really need a very small microcredit to really re-engage in those activities. And these are really micro. $50 microcredit could make a huge difference for women. And that could be supported from the public policy side. You could really, the government should and has the resources, because this is extremely cheap in terms of the total amount of money required, channel through the microfinancial sector that in most Latin American countries is highly active, microcredit lines for women, and especially those based on communal lending that are highly risk-free. And a third measure that is key, maybe relevant to face the emergency, but more relevant for the future of women livelihood, is to include in the procurement rules of public acquisitions rules that give extra points if you buy things from a women-led micro-entrepreneurial enterprise. And that's something we've seen several times for several purposes, and that's something that can be done. Most Latin American countries are turning to public acquisition programs to support the re-engage, the reactivation of the economy, and if we could really have a small price for women-led micro-entrepreneurs to be offering products to these big buyers, could make a huge difference. That's the first bucket, 3 measures that could really change the opportunities and the options to face the emergency for women. Second bucket of policy recommendations has to do with providing women tools to improve their resilience. And I will center in only 2 tools that I think now are key. First, for sure, financial inclusion. In Latin America, financial inclusion has a major gender gap, and it's not decreasing. And we need to ensure that women could take advantage of having additional tools to face these risky times. This means having access to an account, for sure, and to a free of charge digital account, and that could be, as was said before, e-wallets through phones are a key instrument. And this is not just to ensure that women could send and receive transfers or payments or public support, but also that they could really have more tools to face the emergency. One thing we've seen in Peru is that the poorer households already used all their savings and are highly over-indebted, and mostly through informal channels and with very high cost. So we need to provide better tools for people to manage this very critical financial situation, and for women who has less access and use less all these financial services, this could be a key upgrade in their opportunities. And that could be done with public support through several channels, offering free of charge accounts in the public banks, offering to open a digital account with the promise of receiving one small payment, and that could work, and we've seen that working in some other opportunities, but also through the private sector. And I think this is the more interesting. If we provide some incentive, some cheaper money to microfinancial institutions, if they achieve women targets, or if they customize some products and services to serve better the women in need, I think we will see a major change in women's financial inclusion, and that could be a relevant tool for their resilience. Second bucket of tools to help women's resilience is through digital tools, for sure. The digital divide is leaving women out of the access to on-time and good information, is leaving women out of economic opportunities, because you have to get into registers, you will never get the information about temporal job offering if you are not really well connected. And this has 2 policy implications. We need to ensure that women have access and have the minimum device to get the access to this information, and have the capabilities to use this information and to get it. And for the first one, again, you can really work with the phone companies to allow phone companies to lend or to give better devices for women to use them more, if you ensure that they will be able to pay for those. And also, you could do some interesting movements now to help the improvement of digital capabilities for women. And one way of doing it is taking advantage of one not nice thing is that most mothers are attending school with their kids in order to support their kids through the television, through the radio, through a digital device. And within that school class, you can provide a lot of content for mothers and women to improve their digital capabilities. So that's my second bucket. And finally, my third bucket of policy recommendations to support women are for sure related to social protection. And I would like to highlight one specific type of issue that we need to address to support women from the social protection side. At least in the case of Peru, and I will give you this figure just to show you how important this could be. 1/3 of the households are single parent households. And of those, 2/3 are female-headed households. Those households are really struggling now because they were able to have an economy working because that mother was able to go out of the households to work. Now she cannot do that because their opportunities are less available, their job opportunities, but also because she doesn't have any support to the care of the kids or the elders she has at home. There's no community support now because we are working for social distancing. There's no public support because schools are not open. So we really need to move and support these women. We really need a special cash transfer program to support, to allow women to stay at home if they are in a female-headed household, for sure. That's something that could make a huge difference in providing more security for those kids, but also ensuring that that woman could really go for a better reactivation of her livelihoods, staying at home, or finding a way to support her. So I think there's a lot to do there. A second thing that it's really needed for women, and I will end with this, is the support for food. The poorer households in the urban areas in Peru now are facing a major problem with food access. And communal kitchens, that's something that women had a lot of experience in urban areas in Latin America, could be a great support. But most of these communal kitchens are not registered, they are not formalized, and they don't get any public support. Local governments have something to do there. And we are not really ensuring that local authorities have the opportunity, as I said before, to provide temporal job opportunities, but also to provide support for these communal kitchens, for example, that could really help women to face this emergency. There are a lot of things that can be done, but I think if we don't ask people to get the gender lens in the policy decisions, we will fail all these women that are really in need in this moment. And when we need to act soon with an emergency, an urgency sense today. Thank you.
Thank you so much, Carolina. And just a reminder, if you have some questions that you would like Carolina in particular to answer, just please make sure that you ask them as soon as possible. So I'd like to now turn to Dr. Karen Groen. She is an internationally recognized expert on gender issues and development. She has joined the World Bank in 2014 as Global Director of the World Bank's Gender Group, where she has led the institution's development and implementation of a gender strategy that deliberately and strategically targets gaps in endowments, jobs, assets, and increasing women's leadership and voice. Dr. Groen leads collaboration across World Bank Group and with development partners to generate evidence on what boosts gender equality and to identify emerging challenges and opportunities to close the gaps between men and women. Prior to joining the World Bank Group, Dr. Groen was an economist in residence and co-director of the program on gender analysis and economics at American University in Washington, D.C. Over the course of her career, she has led efforts on gender equality for a number of organizations, including the UNU wider program on aid effectiveness and gender equality, as senior gender advisor at USAID, where she has led the development of the agency's gender equality policy, and as senior scholar and co-director of the Gender Equality and Economy program at the Levy Economics Institute at Bard College. Dr. Groen was an associate editor of Feminist Economics from 2007 to 2014, a founding member of the International Working Group on Gender and Macroeconomics, and a member of the Women and Gender Equity Knowledge Hub Commission on the Social Determinants of Health. She holds a PhD and an MA in economics from the New School for Social Research and a Bachelor of Arts in Political Science from the University of California, Los Angeles. Karen, the floor is yours. Thanks.
Thank you so very much. I want to say thank you to everybody and to also say that my comments are very much going to echo the comments of Carolina and Toko, but perhaps I can speak to how the World Bank is operationalizing some of the recommendations that they both spoke to. And let me just say that I think at the outset that I think that I've been telling my colleagues at the bank, and I think this is true for governments, that we have to go from business as usual to business unusual. If we stick with the same models, we will not have a resilient, equal, inclusive recovery. And I think that business as unusual means really thinking through not just smart design in the kinds of policies and programs, which I'll talk about in a minute, but it also means in terms of the partnerships that we need to harness going forward. And I heard a phrase that I also really like that I think is important. As opposed to building back, I think we need to build forward, and we need to build forward stronger and together. And I think that's going to become my new mantra. Like Carolina, I'm not going to go through the gender differentiated impacts of COVID. I think there's been fantastic work that's been done, and organizations like UN Women, which have been tracking, the bank, which has been tracking, other multilaterals are doing a really great job at pinpointing those. So let me talk a little bit like Carolina did about some of the responses and how we're trying to work forward. I have to say that we're not perfect, and it's not inconsistent or even across countries. And we're all in very much uncharted territory. So I think it's also important that we learn as we go. The World Bank has committed to mobilizing $160 billion in finance over 15 months dating back from March, including $50 billion in new concessional funds through IDA, which is our facility to support the poorest countries through very, very low interest loans or grant financing. And we've already released about 38, in fact, it's more than that, it's probably about 40 billion of that finance. And the idea is to ensure a few principles. One is saving lives, protecting livelihoods, ensuring that the response is equal and inclusive and sustainable in the long run, and that we get the macro right as well as the specific interventions right. So part of the work that we're doing in that context is doing a lot of not just delivery of finance, but delivery of technical assistance and delivery of knowledge. So we in my group, for instance, have been trying to put together knowledge and evidence on what works best to support women and girls, what we've learned from previous epidemics or pandemics and financial crises. The idea is to take that knowledge and incorporate that into the design of our lending. We are a group, the bank group has practices that work in so many sectors, whether it's agriculture and food security, to social protection, to transport, to water and sanitation, to education, to health, and so on. So for each of these sectors, we've been working with our gender leads to provide what we call cheat sheets that have really good examples of what smart design might look like in the design of and I'll give some examples in a few minutes, of a social protection loan, or in the design of a water and sanitation operation. So these cheat sheets are important, and they are not just checklists or tools, they're learning documents that have examples that countries have taken up, monitoring methods and other things. The last thing on the knowledge that I'll mention is that we also are measuring impact. We have done nationally representative telephone surveys in 100+ countries. We're in the process of analyzing that data. Some of that is already released. They're both household surveys, as well as what we call pulse surveys on firms. And just a note on this, we've done some work on the firm side, just to complement what Carolina said. We have a lot of initiatives on women-owned firms through our WeFi initiative, but also through our normal financial global practice. And we do know from some of the data that we've collected that women-owned firms are suffering in ways that male-owned firms are not, because they don't have the necessary financial capital buffers. They may not have networks, access to the critical information networks. They may not be digitized. And also they have multiple increased responsibilities, particularly for teaching children, as Carolina said. So this has affected their profits and their sales. And so we need to really put women-owned firms at the center of the response. So our response is across sectors in terms of all of the sectors that I have mentioned. And part of the lens that we're trying to encourage our colleagues to put on as they design programs for mobile health services, or social protection, or digital services, or water, is to ensure that women's organizations are part of the channel of information. They are critical. We have a partnership with Seva in India, which is doing some amazing things during this crisis in terms of helping women, informal workers, to access food and cash, but also to help their entrepreneurs to pivot, to diversify production. So for instance, the women who might have been doing handicrafts are now making face masks or other types of protective equipment. With Carolina, like Carolina mentioned, procurement, the idea of procuring we were doing this in Rwanda, procuring from women-owned firms to help them make essential hygiene supplies, whether it's soap or other things. So women-owned, women's organizations are really critical in this. So let me talk a little bit more, emphasize 5 areas where I think the policy response is really, really critical, and what we can do a little bit differently. So of course, we need to consider, and everybody knows this, essential maternal and reproductive health services as essential. We need to prioritize routine care and essential services, including the treatment of sexually transmitted infections, clean and safe childbirth, contraceptive provision, legal abortion, antenatal care. And early on, we heard that some countries were considering diverting financing for these essential services to COVID response. That's very bad policy. Women don't stop giving birth or having sex, and neither do men having sex in times of crisis. So these services need to be continued, absolutely. And we need to find other ways, if we're going to divert budgetary expenditures, for instance, from capital expenditures or other ways. So the fiscal stance on maternal and reproductive and child health is really, really critical. We knew early on that we needed to provide care options for health workers, not just on a temporary and emergency basis, but also trying to build systems for recovery. And we started to see in some of our health programs the government doing things like paying people for the provision of unpaid care, which we know is largely largely provided by women. Something else that we have started to work through in our health projects is to have a stronger response to gender-based violence, which we all know has increased in the context of the pandemic. And that's happened in a few ways, including through communications activities and through something that we haven't yet mentioned, the provision of mental health services. And we have a number of projects, for instance, ranging from Pakistan and Guatemala and Sri Lanka and India that include GBV-related messages in all communication and outreach activities. They've also given support for mental health services to women and healthcare workers who suffer from sexual violence or harassment. And one project, very large project in Nigeria that we've financed is rolling out multiple actions to address gender-based violence through community outreach, as well as training health workers to identify and set up effective referral pathways. Carolina mentioned the second bucket has to do with employment and livelihoods. And I have to say, I think there's a few things that we need to think about there. For those informal workers at the base of the pyramid, social protection is absolutely essential, as are microfinance services. And what I would add to what Carolina said is we as a bank have the capacity to do some of the expansion as well as digitization of social protection at scale. So we have launched a partnership with the Gates Foundation on G2P. This is government to person payment platforms that put women first. We have three principles and three ways of delivering, different ways of delivering social protection. The first is digitization, but here we know that there is, as Carolina said, the digital divide. So part of what we're doing through our enhancement of social protection is encouraging our colleagues to develop partnerships with the private sector to distribute cell phones to households where women don't have those, to enable women to access information online, develop access financial services and other types of support services. We think that's really important. Beyond cell phones, there are alternative digital transfer methods in markets where cellular technology is not available. For instance, ATM cards that come preloaded with cash is really important. And also converting ID, foundational ID, to be able to use that in terms of debit card or other kinds of services. I was on a webinar this morning with payment platforms from different parts of the world, in particularly East Africa and West Africa. And we're working with companies like Jumia and M-Pesa and M-Commerce to incentivize electronic payment platforms and to have systems that are interoperable. So there are many innovations and things that can happen in the digital space, but we need to put the lens on there to ensure that women not just access it, but can use it both in terms of household security, but in terms of economic outcomes. The second innovation is to ensure that women are the default recipient of cash transfer systems. We're doing this in a lot of places to ensure that that systems leverage official identification, as I mentioned. And I think some of the innovations that we're seeing right now in social protection that I hope will be part of the Building Forward Stronger are things like expansion of social registries, the use of community networks and organizations, and two types of expansions: horizontal expansion, which we're seeing in a number of countries like India, for instance, or El Salvador or Bolivia. And what I mean by that is bringing in workers that have not been covered. So you're talking about informal workers like waste pickers and domestic service, domestic workers and street vendors and the like. That's horizontal expansion. And we need to go beyond making that a temporary expansion, but we need to ensure that they're part of the net going forward. And then there's vertical expansion. And what that means is different types of support, whether it's support for livelihoods, whether it's support for childcare. It's the cash plus model that I think is really, really important. And we're seeing a number of countries actually moving to a cash plus model that I think is really important. We're also seeing in some of the social protection programs that we're financing some innovation in norms change. We're financing the expansion of social protection in Indonesia. And one of the things that's happening through that is behavior change that try to change gender norms and gender roles. So this particular program in Indonesia has a pillar to increase fathers' roles and knowledge in parenting and to share the responsibility. Now, I don't have information on how well that's working, but I think that's something definitely to follow. We're also supporting through some of our other lending actual support for the labor market and for care. So let me give the example in Bangladesh, where we have what's called a development policy loan, which is primarily budget support. And Bangladesh, of course, as everybody knows, has been really hard hit, including with the garment industry. And women, of course, still have disproportionate responsibility for caregiving. So in this development policy loan, the government has said that it would actually approve a draft Child Daycare Act by the cabinet. And within the time frame of the program, we think that the institutional framework will be established. There will be licensing and regulation of daycare centers. That will be initiated by 2022 with publicly financed centers. About 94% of them were operational and before COVID, and a number more, about 60 more are being planned. And these are centers that are being piloted at the community level with NGO supported centers. So during lockdown, of course, childcare services have become scarcer. In this context, we have also initiated guidance for how they can be reopened safely, particularly for the youngest children. And our colleagues at the IFC, which works with the private sector, has issued new guidance for employer-supported childcare in terms of how employers can help their employees, particularly essential workers, with different childcare options. So that is online at the bank. We also I have to say that I think during crises, sometimes regulatory change is easier. And so in a number of our development policy lending, we're trying to push regulatory and legal reform that will really help women. So for instance, Tonga has some legal and regulatory instruments in place that are already designed to support gender equality, but there's a number of gaps in coverage and in the legal framework in terms of women's rights. And one of the things that we're doing there is through an the government is doing is through an employment relations bill that will enshrine into law non-discrimination in employment based on sex, a definition of sexual harassment in the workplace, and a definition of employer liability, implementing a national code of practice and conduct for sexual harassment in the workplace, equal pay for work of equal value, and things like the dismissal of pregnant workers. So even in the time of pandemic and lockdown and economic crisis, we can push this kind of regulatory change that will help build back stronger. I want to mention two more things and then I'll stop. I wanted to mention support measures for women-led and women-owned firms. I mentioned already informal firms and those at the base of the pyramid being targeted through social protection and microfinance. But there's a number of things that can be done for small, formal and medium-owned firms. I've been on a lot of webinars with the private sector in terms of banks and non-financial institutions that are doing things like cost reductions, including suspension of payments, reprofiling tax payments. Governments can actually change things, relax social security obligations. They can expedite VAT refunds. All of those kinds of policy issues are really important for women medium firms. And I think that there's more that can be done that we're hearing. For instance, even though there are big firms that are still being hurt, but larger firms can continue to support women-owned small and medium firms through things like supplier finance and credit guarantees. We're hearing about banks deferring and waiving payments. And one of the things that I've heard a lot about that I think is really important is banks and non-financial institutions working with their clients on crisis management strategies, how you manage inventories, how you can work to build forward stronger. So I think that's really important. The last area that I want to highlight is on prevention and response to the risk of gender-based violence. And of course, this is really a cross-sectoral issue. And as everybody knows, the Secretary General has made GBV response and prevention also an essential services. But one of the things that we're trying to do this in a number of ways, we're trying to ensure that in our health programs, that essential medicines like post-exposure prophylaxis, PEP services, and emergency contraception continue to be provided. Now, there are supply chain bottlenecks that we've heard about with respect to emergency contraception, but this is really important to keep going. Training, as I mentioned, healthcare workers to identify GBV risks and cases and make sure that referral pathways are working. Using technology and communications to diffuse information and have public campaigns on things like healthy conflict resolution. The bank, through some of our community-driven development activities, is trying to continue funding to service providers, especially NGOs that work with survivors of violence, and to increase the capacity of helplines, which is even more important when people are locked down. Training, we're not doing this, but we think it's really, because we don't do this kind of lending, but we recommend that governments do things like training police and judicial bodies to use non-physical techniques, using technology and remote means to help dissipate conflict and other issues. And one of the things that we're doing, that we're working with governments, and this will be my last example, Uruguay is a country that really stands out in its COVID response and economic recovery. It's very multi-sectoral, but one of the things that they're doing as part of the lending that they have taken is on domestic violence, and they have included policy actions to strengthen the institutional response to increase of GBV, including the enhanced capacity of hotlines, including an online system that allows children to request help when facing domestic abuse, providing additional support to women in situations of domestic violence, automatically extending precautionary protective measures during the crisis, and doing electronic monitoring of potential aggressors. So those are all interesting practices. And my last comment is, as we follow these good examples, particularly, we need to be learning about what works and what doesn't. So we need to make sure that we still continue to do the research, we still continue to do the monitoring and the surveillance, which is incredibly important during these times. And we need to collect sex disaggregated information. I'm appalled when I see some of our lending operations that, even in the health sector, that don't collect sex disaggregated information, even on number of cases or cases that are treated. That information is a public good, and it's going to help to target response and make them more effective. So let me close by saying that these examples that I've given are hopeful, that it's not business as usual, and that we can build that stronger. So thank you.
Thank you so much, Karen. Thanks for sharing those very insightful perspectives, and also a lot of the experiences that the World Bank has been involved in, and also for, at the end, concluding on the need to push further on the research, and in particular getting sex disaggregated data. So our fourth panelist is Reneta Lambreva. She is a Senior Policy Advisor in the International Financial Institutions Economic Growth Division at Global Affairs Canada. She joined Global Affairs Canada in 2006 and has been holding policy positions in different streams in the department, including annual reporting of departmental plans and results to Parliament, performance measurement, policy results for key international development and foreign affairs programs and priorities. She joined the International Financial Institutions and Economic Growth Division in 2019 as the lead on women's economic empowerment and paid and unpaid care work at Global Affairs Canada. She holds a master's in public policy and public administration from Concordia University here in Montreal. So Reneta, the floor is yours.
Hello, everyone. I would like to thank the Women's Empowerment Lab for having me here today at their last webinar. in this panel with so many very distinguished panelists, and giving me the opportunity to share our latest work with advancing women's economic empowerment at Global Affairs Canada. So today I would like to focus on unpaid and unpaid care work because it is a long-standing challenge and a critical barrier to women's economic empowerment, and also because addressing it can advance gender equality and improve the impact of our women's economic empowerment programming. In my presentation, I will try to spend a little time on going over the issue and spend more time discussing practical implications of interventions, possible policy solutions, and strategies that might work to address the care burden based on existing evidence. So in the first slide, you can see main barriers to women's economic empowerment. Canada has chosen to implement a feminist international assistance policy that will support gender equality and the empowerment of women and girls here at home and overseas, because this will make families, communities, and countries more prosperous. The policy recognizes the impact of unpaid work on women's ability to engage in paid economic activities and support advocacy efforts and legal, regulatory, and policy changes that advance more equitable workforce at the workplace and at home. It also supports access to childcare and time and labor-saving technologies within households, and it encourages and empowering men to share in domestic, child, and elderly care duties and other household work. We have found that paid and unpaid care work is a cross-cutting and multidimensional issue with implications for economic growth, gender equality, and human rights, and care cuts across other development issues, economic sectors, regions, and countries. And it directly or indirectly impacts the achievements of almost all of the Sustainable Development Goals. So Canada emphasized its commitment to address the root causes of inequalities with respect to paid and unpaid care work as part of its ministerial mandate letter commitment of the Minister of International Development in late 2019. With the statement, develop programming that recognizes, reduces, and addresses the unequal distribution of paid and unpaid care work, and that supports and protects the rights of paid and unpaid care workers to address a root cause of global inequality. So the COVID-19 and subsequent economic crisis have revealed that inequalities related to care work have been exacerbated, and that tackling this issue has never been more pressing. You have probably seen on the next slide, I have a graph that you've probably seen and you are probably very familiar with, so I very quickly will go over it. What is the volume of women's unpaid care burden? Societal expectations attribute to the greater role of women and girls in care work, whether it's child care, elderly care, or care for people with disabilities. Caregiving plays a central role in keeping societies and economies going. So you have seen that before COVID-19 pandemic, it was suggested that 75% of total care work is done by women. And while it is true that in general, women in high-income countries spend less time on unpaid care work than women in low-income countries, on a global basis, without exception, the vast majority of unpaid care work, as it's well known, falls on women. So why is it so important to address care work and women's unpaid care burden now? The short answer is because it is a question of inequality that have been exacerbated recently, and because it holds the potential for economic growth and recovery. In many developing countries, care work is often extended to cover for inadequate or missing infrastructure, which takes even more time away from women in those countries to pursue employment opportunities, better quality jobs, and spend time for self-realization. Social protection doesn't always reach the women, as it was well mentioned by Karen and in the previous presentation by Carolina. And also the concern about girls and girls' education in terms of returning to school rates, as Toko mentioned in her first presentation. The International Labour Organization estimates that the world's population is living longer now, than at any other time in history, and women's care work for the elderly and the sick will be increasing. Despite the growth in demand for care work throughout the world, it remains characterized by void of benefits and protection, low wages or non-compensation, or exposure to physical, mental, and in some cases sexual harm, as it was well presented. Closures due to social distancing have had disproportionate effect on women. Excuse me. And in 2020, the International Labour Organization estimated that of all those working worldwide, 62% were employed in the informal economy. In low-income countries, that percentage is up to 90% of total employment. And women are more represented in informal working situations than their male counterparts. Women are also overrepresented among paid care workers and largely as informal or migrant workers. Other inequalities have exacerbated during the pandemic as demand for women's work and schooling and child supervision was added on to women's regular care and putting away more of women's time from education, employment, or other means of economic independence. This was seen to threaten gender equality efforts that were advanced in the past decades. So new solutions to care work are clearly needed going forward. So we searched, in the next slide, we'll see that we were looking at what existing available evidence are available. There wasn't much to take from to provide concrete strategies and advice, policies and programs going forward. But luckily we had the growth and economic opportunity for women study. And we had a few other studies that we looked at. And the lessons from research and practice, we found that some of the following interventions had a positive impact on women's empowerment: better provisions of essential public service, more investment in time and labor saving technologies and infrastructure, more investment in initiatives to shift perceptions, norms and gender roles about care, and better provision of decent work for women and men. All had the potential to increase the participation of women, mothers with children in the economy. The growth study by McGill University, Evidence from a Slum Settlements in Africa, also indicated that mothers who received subsidized childcare were more likely to be employed than mothers who didn't. Mothers who received vouchers for daycare were 17% more likely to be employed than those who didn't. Working mothers who received subsidized childcare worked fewer hours than those who didn't, and without any loss to their earnings, but leaving women with more time for self-realization. The World Bank Group, International Financial Corporation, researched for evidence to show the benefits for companies when responding to employees' childcare needs. And that was in the Tackling Childcare project, which showed that the majority of surveyed companies confirmed that there is a strong business case for providing childcare solutions to their employees. They noted positive impacts on workplace culture and employee productivity, retention, morale, as well as talent acquisition and positive results of women's career advancements. And the IFC has continued to produce more up-to-date research during the pandemic as well, which is really fantastic. At Global Affairs Canada, we also saw advancing that some of our programs had initiated to advance activities to address women's unpaid care burden, as they saw a need to support the results of other gender equality programming. Some of the examples included childcare services and subsidies, child-friendly workplaces and transportation services were added into existing programming in Jordan, addressing social norms, raising awareness about the value of unpaid care work by engaging boys and men to take on care duties, which was introduced in Somalia in projects, working with employers to offer paid childcare multi-country as part of the IFC employer-provided childcare initiative. We also looked at the study in Quebec this is a different context. It's not a development context as we would normally do, but at least we were able to find evidence of where this addressing unpaid care, what can advance women's economic empowerment and in a more favorable context. Study for the Quebec child care system, which was introduced low-fee universal child care starting in 1998, revealed long-term impacts for women's labor force participation in income security. The participation rate in the economy of mothers aged 20 to 44 with children 0 to 5-year-old rose by 13 percentage points in Quebec compared to only 4 points in other regions for that same time. Long-term impact on Quebec mothers was observed later when mothers of school-aged children revealed better employment, which may have suggested that because mothers who had their child in a daycare at an earlier age had a better chance of being employed later in life. You will see on the table that the labor force participation rate of women aged 20 to 44 in Canada was much higher in Quebec compared to other regions, which became on par for Quebec with very high rates reported in for Swiss and Swedish women of the same age group. The study also showed positive impact on child development and education. Only about 20% of children 0 to age of 4 had access to regulated spaces in Quebec in 1998, while in 2014 that percentage rose about 60% compared to only a modest increase in other regions. It was also observed that universality had a positive impact on reaching vulnerable children from families of every socioeconomic status than other systems such as targeted systems, most that were only targeting to address the needs of most vulnerable families through child subsidies. In terms of economic growth, the study revealed that net growth in the provincial economy had increased. The provincial and federal government collected additional revenues in taxes from an increased number of Quebec mothers who had joined the workforce. A return on subsidies was greater than what a targeted system would have generated, and additional revenues were invested back to enhance quality and address special needs. So on the next slide, in terms of solutions and recommendations in the short run, we were looking at, based on evidence, what works in addressing inequalities with respect to care work. Our approach has to be holistic. That means ensuring that care burden is assessed as part of gender-based analysis plus integrated and innovative, design better and innovative solutions to integrate activities that would address unpaid care within other gender equality programs, including digitalization. Context-driven, time-saving technologies and digital technology, or innovative in cases where, for example, staying at home or kin support is the only alternative for childcare, then seek ways to reward or remunerate unpaid care work in these situations, and rely on relevant data and evidence and collect them to continue to inform program decisions on investment is crucial. If we address these critical barriers, we expect Global Affairs Canada's gender equality programming results to improve. So we need to seek multi-level solutions at the same time. We need to seek opportunities to recognize, reduce, redistribute, represent, and reward care work. This is in applying the International Labour Organization's 5R approach. Engage other social actors and engage men and boys to take greater role in caregiving. Engage, advocate for subsidies or parental benefits, and engage the family, local and community organizations. Support state frameworks to provide support for children, insurance and social protection, and engage in bilateral, multilateral, and partnerships initiatives where possible to support their goals by promoting activities to be integrated to address inequalities with respect to care work. So evidence showed that in the long run, in the next slide, that Low-fee universal child care services have the best impact on long-term transformative changes benefiting women, child education, and the economy. Investments are needed, however, and there are budgetary constraints. This was the case before the pandemic and even more now, given that governments, multilateral organizations, philanthropies, civil society organizations, and other key actors have been investing great efforts to respond to the COVID-19 health and economic crisis. Even less resources are available to address child care needs in the poorest regions where the need is greater, so innovative solutions are needed, including engaging the private sector. How to address short-term needs in a way that can pivot towards addressing the burden of care work over the medium term and into the long term. Advanced activities everywhere where applicable. See if addressing the unpaid care burden would advance program results in other development programming, such as infrastructure, education, job creation, women entrepreneurship, food security, child protection, or any other development programming. Seek where synergies are possible, where women's economic empowerment and economic growth programming can be joined. Seek to define integrated approaches within other programs, trades, market initiatives to address care work, to try to address within that care work and women's economic empowerment. Engage the state to advance affordable quality care and support state actors and other ministries to coordinate better between social assistance, child care, and economic policies that will benefit women's economic empowerment. And finally, continue to assess and continue to recognize what are the most critical barriers to women's economic empowerment by staying close to beneficiaries and continuously gathering more evidence for what can be improved and what works better to improve programming going forward. Thank you very much.
Thank you so much, Reneta. We have a few minutes for a few more questions. So Leva Rouhani from the WEDLA will moderate those. Just a quick reminder, the Q&A is at the bottom. We're going to, at the end of the Q&A, just a couple of minutes, we'll have Martha Meles from IDRC who will say a few final words as well. So with that, Leva, I'll leave you the floor for the Q&A.
Thank you so much, and thank you to our panelists for such interesting comments and perspectives. So I'm just going to ask some of the questions that have been coming through, and feel free to submit more questions from the audience. One question we have from Maureen is that the informal sector is unregulated and does not receive protection nor benefits from government. Won't advocating for policies requiring government to assist the informal sector push government to register owners in the guise of assisting them and subsequent taxing their meager earnings? And another question I'll open up for the panel is, this one specifically for Dr. Karen Groen. You know, there's a great suggestion about building forward, but who should provide the funds when developed countries are spending trillions on their own countries and have indicated they will not increase their ODA, official development assistance? I'll open the floor.
So how do you want to go forward? Would you like me to start, or would you like others to jump in first?
Please go ahead and start, Dr. Karen.
Thanks. Well, thanks for the question. I actually think mobilizing finance is really, really critical. And some countries, some of the development partners have committed to maintain their ODA at 0.7% of their budgets. Of course, it's very, very difficult. In my conversations with donors, though, several countries are still committed to that. There's, of course, the initiatives for debt relief and debt moratoriums, which are intended to actually allow countries this fiscal space to be able to devote more of their own domestic resources to programs like social protection, education, health, et cetera. And I think the debt moratoriums and even debt cancellation is something that is gaining a lot of traction and is important, particularly for the poorest countries. The World Bank Group is also trying to raise money through the capital markets, private finance that we can channel, particularly to our lowest income countries that that we finance. And I think that's also important going forward. On informal, those who are informally employed, I think anything can be a double-edged sword. So I think it means extending, if you're going to register workers or you're going to register firms, it means doing it in a way that is smart and includes the right kind of regulatory protections for those who are registered, as well as the right, as well as the benefits, so that they actually get something in return, and it increases their level of trust in the system. So what we're seeing right now in some of the countries where we're working, and I didn't mention this, but we have a wonderful tracker, for instance, of social protection systems that one of my colleagues in the social protection team is doing, of country changes to their social protection. This is a public database that's accessible on the World Bank Social Protection site. And there are important things. I mean, I think that countries, we actually have done some webinars with groups that look at World Bank accountability. And we're interested in whether in the expansion of benefits, for instance, to waste pickers or to street vendors, whether those are actually getting to the workers. So we're having webinars with WeGo, with SEVA, with trade unions and others to see how well those programs are working, and then beneficiary satisfaction surveys. And I think those things are really, really important, not just during times of crisis, but also if these extensions become permanent. Let me stop there.
Thank you. Any of the panelists would like to jump in?
Yes, I would like to jump in on first on the differential access to education, whether it's just rural. Not necessarily, it's also urban. Though in the rural areas, it's much, much higher, because this is a community that already has limited resources. However, even in the urban areas, they do have, they are facing the challenges, especially access to education under COVID-19. And what we have done at the United Nations Economic Commission for Africa now is to engage municipalities and cities. Just this morning, we had a meeting with the mayor of Ghana to look at what are the challenges and what are the opportunities, whilst recognizing that cities' income have also been hard hit, because those that normally would contribute through purchase of electricity, through various forms of city taxation, are being affected. But the city mayors are committed to looking at how to reach the most vulnerable, especially those that have been affected by COVID. So we are looking at how to support municipalities, also working with the ministries of local government, and looking at, which I think is very critical, and I think, I'm not sure whether it's Karen who referred to it, gender disaggregated data and how to access this, because a lot of our poverty measurement leaves those that are the most vulnerable. So we are also looking at our instruments and the type of poverty measurement that we undertake, so that it does include the most vulnerable. And then, do we need to just look at a long-term response? I think you need to look at both the short-term and the long-term. You need a holistic long-term response that takes us beyond the short-term. Because if we look at just the short-term response to COVID, the effects are going to be long-term. And that's why probably even thinking about social insurance that takes us beyond the current period is critical. And maybe to also talk a bit, I know Karen has spoken to that, the taxation of the informal sector. It doesn't necessarily mean that if you're in the informal sector and receiving social protection, you will lend into taxation. Yes, that fear is there, but the linkage is a bit small. Why? Because the government benefits or the impact on their tax base from low-income earners that are in the informal sector are very minimal. And therefore, yes, social justice is needed to be able to look at how best to protect the informal sector. Thank you.
Thank you. I'll ask one question for the whole panel. In the previous webinar, panel members favored a policy approach based on participatory actions at the local level. How can bilateral and multilateral agencies such as GAC and the World Bank articulate programs based on participatory local approaches?
Renata, would you like to go first?
I would have loved to go first. I wish I was having more hands-on instead of staying in my policy bubble, but I know that our gender equality experts are working very closely with the programs and engaging and ensuring that transformative approaches are being implemented, and working very closely with program beneficiaries. That's part of our gender approach, our feminist approach. So I know that there has been a great number of achievements in terms of working directly with program beneficiaries, engaging them in program design, and keeping an ear to the ground. And this is something that we're looking forward to getting even more evidence in terms of what works and what doesn't, because we realize that not in one context the situation is the same for women. So we need to generate more information about what works where, and it's crucial to have to engage our program beneficiaries in participatory actions, and to invest in local approaches and develop context-driven solutions, because in some cases they are way more innovative, even if they're traditional in that context, and we can learn a lot more than if we are trying to implement something that worked somewhere or we believe worked. So I think we are definitely not undermining those and keeping a close eye on it. Hope that answered the question.
And let me just add that I actually think it's really important. We have two global practices, one that works on urban issues, urban resilience, and they have been also pulling together what cities are doing and community-based organizations are doing around the world. We have a line of work that's on community-driven development, and I think one of the things that we're trying to do going forward is to really have a closer line of sight between the work to expand social registries and social protection programs through governments with this community development, community-driven development, which is bottom up, and working through cities. And I think both that federal approach and then the community-based approach is going to be really, really important. Let me just stop there.
Great. Well, thank you very much. Unfortunately, we're out of time for more questions. And thank you all for your questions, and also for the panelists for taking the time to answer them. I'd now like to just pass the mic to Martha Melas from IDRC. Martha, of course, has been in charge of this new GROW initiative, and we've been working very closely with her on this webinar series. So Martha, if you, the floor is yours.
Sure. Thank you, Sonia, and a round of virtual applause to our esteemed panelists for this very insightful conversation on measures that can be taken to build back stronger and better during and post the COVID pandemic. I've learned a lot. Thank you. My name is Martha Melas. I lead IDRC's Employment Program, which houses the GROW initiative that Sonia mentioned at the outset. I will not attempt to summarize this rich discussion, so don't worry. We don't have time for this, nor would I do justice to the richness. A summary of key takeaways, along with the full video recordings, will be available in the coming days. As was said, this is the 8th and the last in the webinar series on gender implications of COVID-19 in the Global South. And we covered a range of important issues, from labor markets to unpaid care, to gender-based violence, to social protection, among others. Our goal was to stimulate more nuanced and in-depth discussion on how the pandemic is impacting women's lives and livelihoods in low and middle-income countries, and why gender matters in the COVID response and economic rebuilding. We know that this pandemic could be a major setback in advances made in gender equality and in poverty reduction more broadly. But we also know that this can be an open opportunity to build back a more gender inclusive society. So these webinars have been immensely helpful, illuminating the challenges and also possibilities for building a better and more equitable future, as is evidenced in the panel that we've just heard today. Although this is the end of the webinar series, the conversation doesn't end here. And more importantly, we need to turn these and many other insights and ideas into action. So at IDRC, we believe that data and evidence, what works, what doesn't, as we've heard from several members of the panel, will play a critical role, and as does the active participation of women in solutions that affect their lives and livelihoods. And the GROW program will play an important role. We've just launched a call for action research to advance gender equality in the world of work in Africa. We're inviting proposals that are solution-oriented and can have large-scale impact. And as Karen mentioned, to use her word, it's not the business as usual. It's out of the ordinary, so we need to innovate. So we are inviting ideas, proposals. So please visit our website at www.idrc.ca to get more information about these calls. Lastly, I would like to thank our partners at the Wet Lab, in particular Sonia Laszlo, Leva Rohini, and Frank Girmay for spearheading this webinar series, engaging experts, practitioners, and policymakers from across the region to discuss this important issue. And hats off to the team. And thanks again to the panelists and to all of you for joining and for your activity. So I will stop here and over to you, Sonia, for your very last word.
Great, thank you very much, Martha. And yes, as you mentioned, and as you can see, there's the website to the Women's Empowerment Lab, where you can find all of the recordings from the previous webinars in this series, along with summaries, two-page summaries, which do actually identify the 3 most salient research priorities and policy implications from each one of the previous webinars. And a huge thank you to Leva, to Frank, and to Martha, without whose support this series would not have been feasible. And of course, thank you so much to everybody in the audience today and in previous webinars, and to today's really fantastic policy panel. It's been really very eye-opening and just really wonderful. So on that note, thank you all very much, and let's continue this conversation offline.